Okay, thank you very much for all the kind introductions you have given about me. So let me share my screen. Please confirm whether it's visible. Is my slide?
Visible. Yes, sir. It's
Yeah.
visible.
Yes, sir.
Shall I start the session?
Yes, sir.
Yeah. Okay. Thank you. Thank you for all the kind introduction you have given about me. So before I start this presentation, there are few questions which keeps recurring. So these are those questions. Why did you choose to do your master's? That is MD in biochemistry post MBBS. Even today morning, I got this question. Then, what is the scope of MD biochemistry? So these questions keep recurring for me. So why did you choose biochemistry, and what is the scope of it? So I would like to address these questions through my presentation today. So before I directly jump into the scope, I'll just show the course overview of MD biochemistry. Sorry for that spelling mistake. It's MB. It's MD. So it's a 3-year course. So during this 3-year course, you will be posted and you will be working full-time in Department of Biochemistry and its respective diagnostic laboratory. And during this course, during this 3-year course, you will be posted in following departments. For example, you'll be posted in medicine, you'll be posted in endocrinology, you'll be posted in gastroenterology, nephrology, and intensive care unit. This is as per the NMC guidelines and syllabus. There is any MD biochemistry trainee will be posted in these departments as a peripheral posting for at least 3 months. So you will be away from the department for 3 months and you'll be working in these specialties. So this is actually not been familiar to the post MBBS students. So in MD biochemistry course, you will also be posted in these departments just to understand the clinical relevance of biochemistry in day-to-day clinical practice. So this is the goal of MD biochemistry program given by MGR University. So the goal is to enable the postgraduates to achieve competence in teaching, training, diagnostics, and research in medical biochemistry. So this goal is more or less in line with NMC. So I will use this goal statement to address the 2 questions which I showed you in the previous slide. Why did I choose and what is the scope? So let's see one by one. So what is the scope of biochemistry, MD biochemistry as a career after completing MBBS? So 1, you can be a teaching professional. 2, you can work in the laboratory diagnostics. 3, you can be a researcher. And 4th, you can be employed, or you can work, or you can choose to work in vitro diagnostic companies. And last but not the least, there are some specializations that you can do post MD biochemistry. So first, teaching. So the general question that comes into everybody's mind, what's there in teaching biochemistry? What is so new about it? It's the same old cycles, the same old Krebs cycle, it's same old glycolysis, the same old TCA cycle, and so urea cycle, and so and so. So what is so special in teaching biochemistry? See, biochemistry is a first-year subject in an MBBS course. I'm just telling this because the curriculum is getting revised. So just to mention that it's still a first-year subject. So as a teacher in the very first in the first year, you will get to meet the MBBS students right after you join the course. So you will have the responsibility of mentoring them. You will have the responsibility of grooming them. So you'll have the responsibility of shaping them for future. So you will be the first person of contact during their very first year. So the sense of gratification and satisfaction that you receive from the students is what that makes teaching interesting. So as I told you earlier, teaching biochemistry is not just explaining those complex metabolic cycles at all. The changes brought in by National Medical Council, National Medical Commission, like CBME, emphasis on clinical relevance of preclinical subjects. So the style and the pattern of teaching biochemistry has changed a lot. It's no longer the cycles. So it has changed a lot. It will change a lot in future. So that's also will keep you interested in teaching. So you don't want to worry about like So am I going to teach teach those cycles again and again? No, it's not like that. So it has changed a lot. So we are actually concentrating now on the clinical relevance of each and every cycle. So it has changed a lot. So regarding the job profile, if you choose teaching, so it is a job with fixed work timings. So you come to work from by 8 o'clock and leave by 4 o'clock. So it or a 9 to 5 a.m. So it's a fixed job. It's a job with fixed work timings. So it is relatively stress-free. So that's one advantage about this teaching profession. So if you ask me, have these job positions are saturated? No, it has not saturated yet. At least in Tamil Nadu, it's not saturated. In colleges of both private as well as government sector. So this demand is likely to increase in coming years because of the fact that colleges are getting open every year in both private side as well as government side. So this demand is likely to increase in coming years. So the job positions will not get saturated, at least in near future, for next 5 to 6 years. So when you come to the salary scale or pay for this, it's actually pretty decent, and it has improved in recent times. So that's about if you choose to be a teaching professional post your MD Biochemistry. Next. So these are the various designations if you choose teaching profession. You will start as a senior resident, you will become assistant professor, then you will become associate professor, then you'll become professor. The promotions to each level depends upon the years of service and the number of research publications as mandated by NMC. So, so you may not need like 100 papers to get promoted. So it's like from assistant to associate, 2 papers, associate to professor, 3 papers. So 5 papers is what you need to become professor. Doesn't mean that you should stop with 5, can work on to get more, but I'm just telling you. So next, you can work in laboratory diagnostics post your MD. See, again, people are in an idea that biochemistry lab is full of test tubes, chemicals, acids. No, it's no longer like that. So this is what the modern biochemistry lab looks like. Just the instruments. So these are big machines. So completely automated machines. So this will give you a quality lab results, etc., etc. So this is how a good lab looks like. So what is there in laboratory diagnosis? Those machines will give you the results and you are going to report the results. So what is there in it for me post MD? So there is a lot of things are there. So why is a doctor needs to make a diagnosis when he or she sees a patient? So to diagnose a patient, one needs a detailed history, a good physical examination, and results of biochemical and other tests. So laboratory tests constitutes an important part of diagnostic process in the current clinical practice, which is evidence-based medicine. So laboratory diagnostics play a huge part in evidence-based medicine. As Dr. Jamana Reddy mentioned in the initial introduction, among the laboratory diagnostics, 80% belongs to biochemistry. So we will have a very important role in authorizing those reports. So it is playing a major role, and it will play a major role in future, as the future is evidence-based medicine. So being a laboratory professional, there are some advantages. What are those advantages? You will be apprised with novel biochemical markers and their role in diagnosis. One. Second, you will be apprised, or you will be up to date with the latest advancements in diagnostic technologies. Then you will be working close with clinicians. So you will be updated with how the disease is managed and where the biochemical tests are coming in the diagnostic workup. So this is actually a very good advantage if you choose to become a laboratory diagnostic professional post your MD. So in addition to this, there is a role for an MD biochemist in ensuring quality. So when I say quality, it means a good diagnostic lab must ensure that the results they report are accurate and reliable, both to the clinician as well as to the patient. So patient should rely your report. Patient should feel that these reports are accurate and reliable, and clinician should feel, okay, that's what I expected. This is what the lab is also telling. So I can come to a good diagnosis. So a good diagnostic lab should ensure this. In order to ensure this, we need an MD biochemist, because MD biochemist, having known the disease process and the management process, will play an essential role in ensuring the quality. So as a part of ensuring the laboratory quality, there is a process which all labs or most of the labs will undergo, which is called accreditation, which is nothing but an audit by a third-party organization. Okay, I hope you all have seen this logo in most of the labs in, in cities and around. So this is one of the organization, which is a third party, which is involved in doing an audit and giving an accreditation status to the lab. And this organization actually mandates something called authorized signatory to report the biochemistry test results. So even a freshly passed out qualified MD biochemist can be an authorized signatory. So you need not worry about that after completing MD, you have to gain some experience to become an authorized signatory. It's not like that. So even after you freshly pass out, you can be authorized signatory as per this NABL guidelines. So this is very, very important. So what about the job positions? Job positions for MD biochemist in a lab has not saturated yet. And this demand is highly likely to increase in coming years because of the two facts. New labs are getting established, especially after pandemic. We all understood the importance of lab. We all understood the importance of turnaround time. So new labs are getting established. So there will be job positions for an MD biochemist in a lab. Then whatever labs that has been already established or new will go for this accreditation. As I mentioned earlier, they will go for NABL accreditation. As NABL mandates an authorized signatory, so again, that will also open up job positions. So these are the pros of working in a lab, standalone lab. So what will be the positions in laboratory diagnostics? If I choose to work in a lab, what will be my positions? You will be joining as a consultant biochemist. So this is not like fixed. So usually labs will have different terms. So usually the major term that they use is consultant biochemist, which they will divide into junior consultant and senior consultant. So you will be employed as a consultant biochemist. Over a period of time, once you gain some experience, once you have some expertise, you can go ahead and become lab quality manager. So this post is very, very important in terms of ensuring quality in the lab, and this post is very important in getting those accreditation status. After some point of time being a quality manager, then you can go on become a lab head. So these are the various designations in laboratory diagnostics. Okay. The third domain, research. Post MD, choosing a career to be an independent researcher post MD is what we are going to see now. It purely depends on one's own interest and passion. I'm not telling this to discourage people from choosing research as a career path post MD, but what I'm trying to tell is just the truth. So it depends upon one's own interest and passion. Pursue it if you are passionate about it, because being a researcher is not easy and has its own challenges, such as procuring grants, research proposals, and publications. If you choose research as your career post MD, it's not about how much you're going to earn. It's not about money. It's about all these achievements. It's about how you procure grants. It's about how you write your proposals. It's about how you publish your research work. So it's not about money here. It's about achievements. So regarding funding, there are many agencies in India and in abroad to procure funding for your research. For example, there's something called DBT, DST, ICMR, and Science and Engineering Research Board, National Institute of Health from USA, Gates Cambridge Scholarship from USA. There are many agencies that can provide funding for your research upon submission of a successful research application. But I want to reiterate one thing: it's a highly competitive process and demands utmost dedication and focus. But these are the challenges that makes research very, very interesting. These are the difficulties which makes research very, very interesting. So choosing research as a career post MD is actually a fantastic thing. It is actually a satisfactory. It will give you much satisfaction, but it is difficult. It is highly competitive. You have to put more dedication, and you have to be more focused. That's the thing. So far I have discussed 3 career options: teaching, diagnostics, and research. If you choose to work after you complete your MD, if you choose to work in a medical college, you will have an opportunity to be involved in all 3. So you will be teaching MBBS students, you'll be teaching AHS students, you'll be teaching nursing students. 1, you will be involved in the diagnostics, because all medical college will have an hospital, so they will have a lab. Then you will also have an opportunity to do research. So if you choose a medical college, all these 3 can be done. So what are the specializations that can be done post MD biochemistry? So these are the specializations. Postdoctoral, you can do a postdoctoral fellowship in clinical genetics, which is of 2 years duration, which is done by CMC Vellore. There's one more thing called postdoctoral fellowship in molecular pathology for 1 year. Yes, MD biochemistry is also eligible for this course. Third, NMC says MD biochemists are eligible for DM in clinical hematology, but I have never met someone who has done that. After MD biochemistry, choosing DM in clinical hematology, I've never met someone, but I think it's not that straightforward also. Because as far as I have discussed and I heard from my colleagues and friends, after an MD biochemistry, some institutes will have some rules that you have to work in an emergency medicine for 1 year or 2 years. So they won't give you straight away after MD biochemistry, they won't give you DM in clinical hematology as a straight away option. So it has something to do. So is there any opportunities for an MD biochemist after completing MD biochemistry to work in abroad and overseas? Yes. For example, Australia. You can go to Australia and work. There is no special exams needed. They just need one detailed logbook, which you will follow in MD during your MD course. And they will keep an interview. Upon successful completion of an interview, you will get a posting in. You will get posting as a faculty in Australia. Second, Gulf countries. Yes, there are a lot of openings in Gulf countries. And again, there is no special exams needed, but you have to complete an interview. Third, United Kingdom. Here there is one good option here. So after doing an MD, you can do FRC path in a branch called chemical pathology or clinical biochemistry. So if you are able to complete step 1 and step 2, and then there will be a project proposal. If you complete all these 3, then you can get direct appointment in the UK. Or you can take the usual route, try lab exams, GMC registration, and then you can go and work there. In European countries, yes, there are few openings in European countries also, for example, in Denmark and Germany. For this also, there's no exams needed, but you have to learn their language, which is very important, and the interviews is necessary. So coming to the very important question, does the institute or the college where you do MD matters? Yes, to a certain extent. Yes, it matters to a certain extent. If you get a good rank and get a seat in a good college, good institute, yes, you are lucky and you are well placed, and you can learn a lot of things from them. But if you don't worry, because the opportunities to learn now is very wide and can be easily accessed by anyone from anywhere. If you ask me, when I joined MD biochemistry in CMC Vellore, yes, there are a lot of facilities for me to learn, and the whole curriculum was systematic, everything was there. But if you want to learn how will you analyze the genomics data, that time you have to look for opportunities. But now it's everything in the fingertips. So now everything is in Zoom. You can just join an online course and you can do it. So opportunities to learn is wide now and can be accessed easily by anyone from anywhere. So at last is how you equip yourself with the latest advancements and grab opportunities to master yourself. So that is very, very important. So Thanks for giving me this opportunity. Thanks Indian Medical Association and Medicine for giving me this opportunity to share my thoughts regarding the scope of biochemistry post MBBS. Thank you very much.
Thank you for this wonderful session, sir. Now, I call upon Dr. Jamuna ma'am to give remarks of this session.
It was an excellent session. And my personal favorite on the session is, as Dr. Jagan rightly mentioned, that the sense of gratitude by the students and whatever course they take up, like PG, super specialty, will be part of their journey throughout their professional and most of the time in their personal career as well. And final year, even in final year, they used to come and ask us like, Madam, I don't understand this concept, please, why don't you teach us? So yes, that is really special about all the pre and paraclinical subjects. Again, I would like to emphasize here as it's no longer called as a non-clinical subject. So we call the first year as preclinical and second years as paraclinical. It is literally bridging the gap. And I personally believe we shouldn't be calling even as pre and paraclinical. Every subject is clinical, and we actually correlate with the clinical picture and we authorize a report. So gone are those days where simply the reports are generated in the machine and sent. So each and every abnormal report is issued. So in that regard, I personally liked Jagan's presentation very much. Thank you, Dr. Jagan, for being with us today. Thank you very much.
Thank you. Thank you.
Thank you, ma'am. Now we move on to the end of the session. Vote of thanks by Dr. Raghunathan sir.
Thank you, Godwin. Thank you, sir, for joining with us today. It was really a wonderful session, eye-opening session for many people, those who think, especially in choosing a paraclinical or preclinical subject. As ma'am told, no longer any subject is called as preclinical, because like even in any other institution, the clinical side is supported strongly by the laboratory side, especially biochemistry, pathology, and microbiology. And in that regards, all these subjects are now equally important. So as we know that already in the counseling, pathology, now it is like getting filled faster after medicine and surgery. So that much importance has been gained and knowledge has been gained by the students, those who are trying to pursue their post-graduation. Similarly, even awareness on biochemistry and other subjects are necessary so that people can think and choose this as their career after their MBBS. So I would like to thank sir for joining with us among his busy schedule. And I would like to thank Dr. Abul Hasan sir, Chairman IMA JDN Headquarters and President, National State President-elect IMA TNSB, Dr. Ariyaran sir, Chairman of IMA JDN TN, and Dr. Jamuna Rani ma'am, IMA and co-chairman, and professor at Department of Pathology from Bharat Medical College. I'd like to thank all the participants of today's session, especially around 800 students have been registered for today's session. And for all of them, this session is going to be very useful in choosing their career post MBBS. And that too, now the NEET examination is over and counseling is awaited in 1 or 2 months. And this session will be helpful for them. We have been doing this career guidance session for the past 2 to 3 months, and we have already completed more than 9 to 10 sessions in the various opportunities and various guide careers in the post MBBS. And this session will also be remembered as a very important and very useful session among our webinars by IMA, JDN, and Medicine. Thank you so much, sir. And thank you once again to all the office bearers of IMA, MSN, and JDN TN for joining with us in today's session. Thank you, Godwin, for hosting this session wonderfully.
Thank you, sir. And thank you all dignitaries.
Thank you. Thank you.
Hello, am I audible to you?
Yes, sure.
Okay, any more speakers to be joining?
You can just close the session. Thank you.
Okay, so I would like to take a minute of yours. So, well, thank you for extending us the opportunity to host a session, and I hope you had a seamless experience. Kindly allow us a minute of your valuable time to share a short presentation to introduce our platform, Turnet.
पता है ना वीडियो नया वाला कब करना है? नहीं एकदम अच्छे से अटेंटिव होके बोला लेना, ठीक है?
Thank you so much, everyone. It was a wonderful session. Hope to meet you again in our platform soon.